to approve the selection committee's choice of HealthStat as the Augusta, Georgia on-site clinic provider.
Mr. Russell.
Mr. Mayor, members of the Commission, several months ago when we began talking about the current Blue Cross Blue Shield contract, you asked us to continue to look for ways that would help improve the cost of that contract over a period of time. In addition to that, you asked us to continue to look at ways to look at privatization, taking over our particular health contract without the benefit of an outside agent, but try to do it internally. I think this is one of the first steps to do that in a way that would serve our employees, but also in the long term have a positive cash flow aspect for us as we do that.
You did task me about a year ago, is when I was hired as your consultant, to come in and try to find some cost containment strategies for Augusta Richmond County. The first thing we looked at was, were you with the right carrier, which we determined last year Blue Cross was the right carrier for you. The second thing was to look at whether or not you were in the right funding method, being fully insured or possibly moving to being a self-funded group. Last year, I determined it wasn't the right time. I hope to be back in front of you in about 45 days with my findings on whether or not 2013 is the year to move to self-funding. I will tell you, all my preliminary findings are showing you're in a much better place, and it looks like this might be the right time to go to self-funding. So the second step of that then was to look at other things. What other things can we do besides your funding method to help you start controlling your healthcare costs and then start beginning to reduce those costs? So I looked at a variety of different things and started looking at an on-site clinic concept. One of the reasons I looked at this is because regardless of whether you stay fully insured or go self-funded, an on-site clinic can still work for you. Now, I will tell you up front, if you're self-funded, you're going to see much higher return on your investment as a self-funded group versus fully insured. However, regardless of what you decide to do in 2013, this is something that can save you and your taxpayers money. Just to recap, you're spending about $20 million a year right now on your health care costs, just in your medical plan alone, covering about 2,200 employees. So that's about $9,000 per employee per year. And again, I will tell you from my experience, that is much higher than I'm seeing from other municipalities. Part of that, again, is I think is because you're a fully insured group, and we probably need to get to that self-funded platform. So in order to do that, there's really three things that I've looked at in your claims information and how you operate your health care plan that has to be. There's three goals that you really need to achieve to start seeing significant reduction in your health care spend. That is reducing the waste within your health plan, improving your employees' overall health and wellness, and just overall improving how your employees understand how to use the health plan. That is what this on-site clinic can do for you. You are about as close to a perfect group as I've seen in a long time as a candidate for an on-site clinic. I've run your analysis probably 6 different ways, and every way comes up with an on-site clinic will almost immediately start to reduce your health care spend. If we roll it out the right way, if we get your employees to buy into it and utilize the clinic like it's supposed to be used, you will absolutely see a return on investment within the first 12 months. I've talked with the vendor that we would like to move forward with down the road, and it looks like even within the first 8 months you're actually going to start to see a return on investment. The conservative approach is about $550,000 is what it's going to cost to run the clinic over a 12-month period, but we're seeing over $1 million on a return to Augusta Richmond County. That's after you pay the $500,000 to run the clinic. You're still going to see about $1 million in savings. So I think that's one of the reasons we really want to get in front of you and let you start thinking about this, let you hear this, because the faster we can move forward on this, the quicker you're going to start to see that return on investment.
Thank you, ma'am. And I'll tell you, and I know everybody wants to have time to review materials and all, but it sounds like a very good deal to me. Commissioner Lockett.
Yes, sir.
Thank you, Mr. Chairman. I think I have 2 questions. One, you brought it up. I was planning on asking it anyway. The employees, what will we do to entice them to make them want to become a part of this program? Because based on what you said, we can't make them. Is that correct?
Well, no, and I say that. I don't know if you want to make them. There are certainly ways to design your health plan, especially if you go self-funded, to steer your employees to your on-site clinic. The truth is the easiest way to make them buy into this is to make the clinic free for your employees to use, especially the ones that are enrolled in your health plan. I would say to make it free for all Augusta-Richmond County employees, including the ones that aren't enrolled in the health plan, we may want to be careful with that, because what you don't want to do is have employees drop your health insurance coverage and only use the clinic as their source of medical care. But I think for employees that are enrolled in the medical plan and are paying a premium to be a part of that plan, the clinic should be free to them.
And my last question is one that's going to be unexpected. Based on the Supreme Court decision today, will that have any impact on the plan?
On the on-site clinic plan?
Any part of
Let
it?
me tell you, on the Supreme Court, actually, that ruling on upholding the Affordable Care Act, and honestly, that's probably one of the reasons this was a little late getting to you, because I was waiting and hoping that was going to go through, because what that did for you, there's a portion in the Affordable Care Act that allows employers that have wellness programs, disease management programs, and things like that. It's going to allow you to charge a much higher premium differential for employees that participate in programs like an on-site clinic versus employees that don't. Right now, there's a restriction of 20% premium differential is all you can charge as an employer for employees that participate in wellness, employees that don't. Under the Affordable Care Act, that's going to be increased to 50% down the road.
Thank you very much. I enjoyed your presentation the first time and even more this time. Thank you.
And I'll tell you, I just think a natural incentive is just the proximity and the ease of access to the facility. Commissioner Hadney.
Ma'am, one question, please. Number one, you said reduce waste in health plan. Would you help me?
Sure, absolutely. When I look at your information from Blue Cross Blue Shield, and I look at it every month, and I track what's going on within your health care claims, there is a lot of spend on specialists. A lot of your employees are going to specialists when they should be going to a primary care physician. A lot of your employees are going to a specialist only to find out it's the wrong specialist, and then they have to go to another specialist. So that's what I'm talking about with waste within a health care. Your employees don't know where to go. An on-site clinic, by going to an on-site clinic, they will help them determine which physician they need to go to, which specialist they need to go to. Every time they go to the wrong specialist, you're being charged. That's hitting your claims, and so you're paying for it regardless. So by reducing that spend, and I believe in 2011, if I'm remembering correctly, there was almost $1 million in claims just to specialists. So by reducing that by something as simple as 20%, you're going to see, you can start to see there's a $200,000 savings right there, and so on and so on. So that's really the waste in your health plan, is that the employees just don't know where to go.
The reason I asked that question is that I was under the impression that don't mean a whole lot, but was that most, the way you get the most specialists is you got to be referred by your primary care person. That's the normal process, I thought.
And unfortunately, that's not the norm any longer.
It's
Employees
not.
can self-refer.
You can just go on to a specialist.
Correct. As long as they go to a specialist that's in the Blue Cross Blue Shield provider network, they can go see whoever they want.
You call your shots. Okay.
You sure can.
Right.
Commissioner Guilfoyle.
Thank you, Mr. Mayor. Thank you for the presentation so far at this time, and appreciate all your knowledge and your study on this. How many other municipalities have you had inducted this as far as this dog in a box?
I personally have worked with about a dozen municipalities over the last 8 years that have done on-site clinics or some form of an on-site clinic. Now, the particular vendor that we would be recommending has extensive background with municipalities, which was actually one of the main reasons that we chose them, was because of how many municipalities they've actually worked with and how successful they've been with their municipalities.
So your success in the savings is pretty accurate.
Oh, absolutely. Yeah, absolutely.
Thank you so much.
Mr. Mayor Pro Tem.
I feel a lot better about this than I did, but I'm still a little bit confused. If we implement this plan in 2013 and we enter into a contract to be fully insured in 2013, how is that going to save us money, because we're still going to pay Blue Cross a fixed amount.
You're going to pay Blue Cross a fixed amount, but the amount of claims that are filed with Blue Cross is going to be greatly reduced because your employees are going to be using the clinic, and there won't be a claim filed with Blue Cross if they go to your clinic. And the clinic, for a lot of things, can do at a much lower cost than Blue Cross is contracted with out in your community with the providers.
But that savings doesn't come back to the city. That savings is to Blue Cross.
No, because here's what we hope to have happen. We would like to get this, as Fred said, in place because this is a huge negotiating tool for us with Blue Cross at your renewal if you stay fully insured. Again, I'm going to just go out on a limb here and tell you all of my numbers that are coming up so far say that you guys need to move to a self-funded platform in January. You look much better this year than you did last year.
But my concern is that I'm not sure that the will of the body is to move to self-insured. And so next year we really won't see a savings because we'll be negotiating for 2014's rates.
Right, but
that would be where the savings would be.
If we have this in place prior to negotiating that renewal with Blue Cross, I can negotiate lower rates with Blue Cross based on the fact that we can show them how many less claims are going to be filed with them, how many more employees we're going to be able to get engaged with preventive care, disease management. There's some things we can actually carve out from your Blue Cross contract and do in the clinic at a much lower rate.
Okay.
Commissioner Brigham.
And it's my understanding it's not only just Blue Cross that we might be negotiating with, that we are looking at bids on our health insurance.
Yeah, I mean, the reality is we will go out to...
It may not be Blue Cross,
Correct.
It may be another vendor besides Blue
Correct.
Cross.
Absolutely. But I will tell you all of...
We'll use the negotiations on either.
Absolutely. All of the vendors that would be viable carriers for Augusta Richmond County have worked with on-site clinics in the past and understand this concept. So yes, even the Aetnas, even the United Healthcares will accept this as a cost-saving tool and will negotiate with us.
If I can, Mr. Mayor, I think that
Mr. Russell.
That what this does is help us move towards what might be a self-funded platform. And even if we decide not to do that, it puts us in a whole lot better negotiating place with whichever vendor that we deal with. So, while there might be additional questions and whatever, I think you've probably got the bulk of the information in front of you, and the faster we move with this, the more impact it's going to have.
And if I can just add one thing, this is your clinic, so the great thing about this is it's going to be designed to meet your needs. This is not just a cookie-cutter clinic we're putting in place. One of the things we envision in the future is also incorporating your clinic as your first report of injury for your workers' comp as well. So there's a lot of other savings down the road that we see, that we envision coming out of this clinic. And again, we haven't even hit on the absenteeism, reducing that because employees, a lot of times if they have a 2 o'clock appointment, they go to their doctor, they just don't come back to work. They come here, they go to the clinic, they're back at work in 20 minutes. So, there's a lot of other costs, soft dollar costs we haven't added in yet.
Mr. Lockett, as chairman of the Administrative Services Committee, would you be potentially ready to vote on this today, or do you want it to go back through your committee?
Mr. Mayor, I have one question. You mentioned 45 days. What was the 45 days? Does that mean you need to know something?
No. What I was saying is I'm getting ready to do what the commissioner at the end said earlier, which is release your RFP for your medical insurance on fully insured and self-funded. And what I hope is in 45 days to be back in front of you saying, here is my recommendation for 2013. You need to be fully insured or you need to be self-funded.
Okay, if you didn't get this information, if you didn't get approval on this until the 17th of next month, will that put you in a pickle or what?
We can work in whatever timelines works for you.
Mr. Mills, I would like for not only myself but my colleagues to have a time that it sounds real good, but I do think that if the 17th going forward next committee on the 9th and back this back on the 17th, that's not going to mess up things. Why rush it? If it's going to mess up things, we just have to consider it.
Okay, would you like to make a motion to put this back on the Administrative Services Committee for the next committee meeting?
Waiting for an answer.
Oh, hang on. Mr. Russell.
If I can, Mr. Mayor, and obviously, if that's the will of the body, we can do that. It will back us up some. It would cut some of the data that we'd have available, but that's the will of the body, and we can work with whatever you want there. I just wanted to make sure we weren't going to put ourselves in a hole.
Mr. Lockett, would you like to make a motion to that effect?
Well, Mr. Mayor, what I was going to say is trust in the administrator and this young lady. If they feel that waiting until the 17th for a positive vote from this body is going to set them back some. But I'm a little leery of that because we have too many things that come before this body that we're in a hurry to do. And we do it. And oftentimes it doesn't work out. But what she said on both occasions, it sounds real good to me. Now, if it's the will of the body that this be voted on tonight, I'll go along with it.
Okay, would anybody like to make a motion to approve?
Motion to approve.
We have a motion and a second. If there